to Slow Medicine Radio. Our host is integrative medicine Dr. Michael Finkelstein. Michael offers medical advice from a holistic paradigm, including both medical and metaphysical philosophies from the full spectrum of human experience. Slow Medicine Radio offers fresh ideas on how to attain a state of wellness that seems distant given the limitations of today's medical paradigm. It introduces you to thought leaders who connect the dots between theory and practice, examining health from a broad perspective with regards to medical diagnoses, conventional and alternative therapies, healthcare policy, and related topics that warrant further thought and discussion. Slow Medicine Radio does not prescribe to take this or do that. Instead, it offers an open-minded, intelligent, and practical approach to living, resulting in greater health individually and collectively. Here is Dr. Michael Finkelstein, the founder of Sunraven, the home of slow medicine in Bedford, New York.
Well, welcome to Slow Medicine Radio. I'm your host, Dr. Michael Finkelstein, and we're here every Monday on WVOX 1460 AM and worldwide at WVOX.com. Here every Monday at 5 o'clock to speak to you about the subject of health from a much more holistic paradigm than you might normally receive, especially if you've been waiting in your doctor's office for that appointment. And I say that tongue-in-cheek, of course, but I realize that there's so much frustration out there with regard to getting the attention that you deserve when it comes to questions about your health. And I think even the paradigm of healthcare is often limited and so focused on the physical that people are not encouraged, even given specific advice on how to bring in and incorporate other aspects of life and living into their state of health and their well-being, and to really improve the quality of their life, and in so doing, I believe, improving the quantity. Today's show, it's going to be you and me, meaning that there is no invited guest, and so I want to encourage you to call me and share with me any of your thoughts or questions on the subject of health. The call-in number is 914-636-0110. Again, it's 914-636-0110. And I mean it. Ask me anything. I think that the challenge for me always, and you can actually participate in the shaping of this program, is to establish a relationship with you so that I become one of your go-tos, one of the people that you can call when questions arise as to what you can do about this or that, or what other things might be out there for you to consider, and even to address some of the things that are going on in the world around us. On that subject, today's headline news, of course, as many of you are aware, is Hillary Clinton is diagnosed with pneumonia. And we could talk about Hillary Clinton, of course, although this is not a political show, so I would suggest you not call me if that's your interest, but we can talk about the subject of pneumonia. Pneumonia is a medical condition, of course, that people are familiar with, at least they've heard of, but the questions about what is pneumonia, what it isn't, what other things look like pneumonia, how does one get pneumonia, how does one heal from pneumonia, what are the other respiratory conditions that often are related, our immune system, all get wrapped up in this conversation. And so I think it's a worthwhile one. In addition, this is the fall, or the beginning of the fall. For many, it's a literal breath of fresh air, but typical of the fall is a change in the air. We know that the heavy, moist air, the oppressive heat is probably mostly behind us, and we get into this transitional phase between the season of summer and the season of fall. And many, many people are prone, specifically now, to conditions of the respiratory tract because the air quality has changed. People who suffer from seasonal allergies, this is one of the two most common seasons for that to happen. The other is spring, of course. And pollen first starts circulating in the air after the dormant winter. But the next most important time is now. And many of you might know that your past history is one where this is the time of year you're susceptible. And the question could be, what can I do to help myself? Maybe, make that less likely to happen. Or if I was to get ill, how can I recover more quickly? So let's talk about the subject of respiratory tract health. And of course, I invite you, if you care to, speak to me about any subject, really. That's just one that I think is heightened in people's minds right now because of this question of what has happened to Hillary Clinton, who, by the way, I would say, despite your political views, I think we all recognize we wish her well and that she heals quickly. I wish, in fact, that she came to me. I live very close to where she lives. and asked me for some help because I would like to offer her some thoughts, not just obviously on her grueling schedule and what it must be like to shake hands with 1,000 people a day or to give long speeches into the evening, but in terms of the balance that's required. In fact, whoever becomes our next president, this subject is valuable. So I put myself out there to any of those people who support candidates running for significant political office or those running big businesses and responsible for many lives to figure out how to take care of themselves. And that's not just your physical body. To give fair time to the alternative candidate, Mr. Trump, he is supposed to be on my medical school colleague Dr. Oz's show this week, and he's going to bring his blood tests, so they say. And that's an interesting subject as well, because it's a little bit more than blood tests that we'd like to know. In fact, I've, as a practicing internist for many, many years, blood tests on dying patients sometimes look pretty normal. You know, the body has a remarkable capacity to maintain its balance. Sodium content of a dying person tends to be the exact same as the sodium content of a vigorously healthy 21-year-old. And so we could easily get lost in details that may not really bring us closer to truly understanding the health of a person. But we can certainly look at somebody and how they take care of themselves, what they do in terms of rest and periods of restoration, what they eat, how they deal with their emotions, how they handle the inflammatory conditions of life all around us. I mean, these people can be remarkable role models for us, and I would love to have an opportunity to speak to them directly. So if you represent them, please call me. If you represent your children or your spouse or your elderly parents, or you're looking at the person in the mirror every morning that you most dearly care about and want to have some thought and a process to discuss with me, then I invite you to call 914-636-0110. So again, we're here at WVOX 1460 AM, and it's every Monday at 5 o'clock that we'll have this discussion for a while. And maybe you're a little bit shy right now, but I encourage you to speak up, because it's when your questions get revealed that we can then get into this dialogue, which will show how I work in slow medicine, which is to connect dots between the physical body, which often is the thing that ails us most obviously, but then to work in our relationships, work in our balance, work in the questions of the meaning and value of our life, why we want to be healthy in the first place, what are we going to do with this life. All those things I think have remarkable bearing on how we do, how we feel. So let's talk about pneumonia. Let's just start right there. And what is pneumonia? So pneumonia is an infection of the lung. It, in fact, can be a non-infectious condition as well. There are subtypes of pneumonic inflammation conditions that look like pneumonia, but they're often not described and called pneumonia themselves. But there's pneumonia, the hallmark of pneumonia is infiltration of inflammatory molecules and fluid in a section of the lung, most often due to an infection. There are several groups of infections that can do this. So there's bacterial pneumonia, bacteria, like the pneumococcal bacteria. People sometimes get vaccinated for that, is the most common. But then there are viruses. There are fungi that can cause pneumonia. And pneumonia can be a result of an inflammatory process. Perhaps it starts as an allergy of one form or another that plugs up and clogs airways that leads to stagnation and blockage, the way sort of a pimple on your face is a pus pocket. And what you do to alleviate that often is you pop it. The lung is not one of those areas where you could just reach in and pop. So what happens in the lung when consolidation occurs is that section of the lung becomes dysfunctional. And what is the lung for? The lung is to bring oxygen into our body and to release carbon dioxide. And when a section of our lung is not doing that, then we really lose the capacity to be fully aerated, oxygenated throughout our body. And that is one problem. Another problem, though, is the body has this interesting way of handling infections, and that brings a lot of molecules to an area that's sick, taking energy from other places. So what could have happened to Mrs. Clinton over the weekend was that because she has all this blood flowing to one little section of her lung, it may only be 10% of her lung, then it may not be in her legs, it may not be in her brain. Her heart circulation may be different. Now, pneumonia also can cause fever, and fever changes our whole metabolism. It increases our metabolic rate so that we generate the heat that is produced. And that, as most people who have experienced fever, leads to a condition where we feel pretty blah. Combine that with standing for a while in a crowd where you're not moving much in terms of your legs, and maybe you haven't had enough water to deal with the inflammation, sucking water out of other parts of your body, and the heat of the day, even though it was only moderate yesterday compared to other days. In combination, that could have clearly explained what we witnessed her experience. That's not a conclusion, by the way, because I have not examined her. But she may or may not have bacterial pneumonia. It's not so easy to diagnose. X-rays can show the inflammation. It can show consolidations. It's usually a big white patch on an X-ray because the X-ray beam doesn't penetrate liquid as well as it penetrates air. The lungs should be filled with air, and when the section of pneumonia occurs, it's filled with liquid, and it's dense, and so it looks white on an X-ray. And so that's one way to diagnose it. A doctor can listen with a stethoscope and hear a unique sound instead of air moving in and out, often something that doctors refer to as crackles, because that's sort of what it sounds like, and in one area of the lung. And usually a person not only has fever, but looks terrible. And I will say, looking at Mrs. Clinton's picture yesterday, she looked terrible to me. If she was in my office, I would have, in a nice way, said, hey, you don't look so good. She looks sick. And I think that that's literal. Obviously, something significant has happened to her. People who are older, and this is an important issue, and older could mean, depending on the state of general condition, but older could be 60. If somebody's in really poor health or has heart condition, could be younger. But people who are older don't have the capacity to handle this type of infection. A lung infection is serious. It's not like even a skin infection or a sinus infection or a bladder infection. The lung is a highly vascularized tissue in the center of a body doing a very important function moment to moment, breath by breath. And so when it gets sick, the whole body really can shut down. And the bacteria, if this indeed, again, was a bacterial process, bacteria that cause pneumonia tend to circulate through the body because the lung is so vascular, and the blood and the lung come together on many, many points. And so there's usually a systemic response to pneumonia. And for most people, they're not happy walking around. Now, we do have that term, walking pneumonia. What's that mean? It means somebody has pneumonia, but it's not so bad, that they're able to walk around. Typically, walking pneumonia is probably more likely than not a viral condition. Same virus that might cause a cold, just somehow also infects the airways. It doesn't produce typically as much fluid in the lungs or as much debility overall. And that's often the difference. And so how does then another thing get involved here, our immune system? What we saw from Mrs. Clinton for the last week or two is that she was coughing. She sounded congested. We hear now reports that maybe she had seasonal allergies, something that I mentioned earlier, which was the idea that maybe she's responding to changes in the air quality or pollen of a specific plant. This time of the year, goldenrod is particularly populated, and so there's a lot of goldenrod. You see it on the side of roads, that nice, pretty, deep yellow flower. But it's in the air for people who are sensitive, the cause of a lot of illness this time of the year in terms of respiratory tract. And the common symptoms are scratchy throat, watery eyes, signs of simple allergy of the upper respiratory tract. And the upper respiratory tract, that term is referred to as anything above the lung. So the lung is lower respiratory tract, and everything above the lung is the upper respiratory tract. And so that includes the sinuses, the throat, the airway in the neck. Those are all parts of the upper respiratory tract. And when they get infected or inflamed, we tend to have those common cold-like symptoms, which are annoying, but usually not associated with fever or high fever anyway. Usually self-limiting, meaning they get better on their own and often persist for a while and are nagging. Sometimes the symptoms respond to symptomatic relief with over-the-counter medications, or for me these days with herbal remedies and even an approach to food and diet that can change how we react to substances, how inflammatory we are, how sensitive we are, and I think that that's something worth discussing one day. But the upper respiratory tract symptoms that she was manifesting last week could have been a prodrome. They could have said that her airways were getting inflamed, and then as a result of that inflammation for a week or two, maybe she was a little bit more vulnerable, combined with her vigorous schedule and some of the other demands, to bacterial invasion of an area of her lung. Again, maybe one area of her lung, just because of the drippy drip of her sinus condition, got a little congested. And one of the myths that people need to understand is that most forms of pneumonia are not contagious. I want to be careful with that. Don't write that down as a final answer, but realize that the bacteria that cause pneumonia in most people live in our respiratory tract normally. So the idea here is that something changes in our immune system that allows that bacteria that lives with us all the time to now somehow populate and invade. There are some forms of pneumonia, like tuberculosis. There are other viral forms of pneumonia that tend to be definitely contagious. But bacterial pneumonia tends to be a result of bacteria that live with us all the time. Just like skin infections, we cut ourselves and then it gets infected. It's not because we shook hands with somebody who had a special bacteria. It's because now our skin, which has normally a great barrier against the invasion of small bacteria, now it's open. Now we're exposed to the normal bacteria that live on our skin, some of which can be pathogenic, meaning they can create disease. So that's a quick lesson on pneumonia. There may be a little bit more, but I'm going to take a pause here to give you a breather. Literally, I always say, it's a good idea to breathe, especially when you're stressed. And sometimes people say when I speak too long and give too much information, they get a little out of breath. So I'm going to give you that chance to take a breath. But write down the number, 914-636-0110, and ask me a question. I'm here to answer it. And I'll speak to you in a minute when we return.
You're listening to Slow Medicine Radio. You can find out more about the show and the work of Dr. Michael Finkelstein by visiting his website, slowmedicinedoctor.com. Slow Medicine Radio is sponsored by the Slow Medicine Foundation, dedicated to providing community-centered, experiential, and reflective learning for individuals, families, and groups, offering educational programs, events, and resources, as well as insightful health evaluations with customized medical guidance. Dr. Finkelstein works with his wife, Robin Queen Finkelstein, at their farm, Sunraven, in Bedford, New York. And they invite you to visit and take advantage of this unique resource, including men's and women's groups and couples programs. If you think about it, much of what we experience when we don't feel well is a result of the fast world and how it affects us. Therefore, if fast is the disease, then slow is the medicine. Visit Sunraven, the home of slow medicine in Bedford, New York. Go to slowmedicinedoctor.com or call 914-218-3113. And thank you for tuning in Mondays at 5 p.m. right here on 1460 WVOX.
Well, welcome back to Slow Medicine Radio. I'm your host, Dr. Michael Finkelstein, and I'm sitting here in the studio in New Rochelle, and it's such a beautiful day. The air, this is one of my favorite times of the year. I would say I would love it the best if it wasn't for the fact that winter followed. But on the other hand, I really like when the air gets this clear and this light in some ways. In fact, that's for many systems of medicine, they recognize that seasons have a real effect on our body and in specific areas. And as I mentioned earlier, since we've been talking about pneumonia, the lung and the respiratory tract is particularly sensitive to this air effect. And this is a time of the year that we tend to be sensitive to that. So I think it's an important subject. Again, if you want to call me for any question related to this or even another subject, then do 914-636-0110. Let me shift a little, though, and talk about something that's definitely related to this condition, whether we call it pneumonia, a viral illness, respiratory, reactive airways. The common mediator of all of that inflammation, the thing that actually produces the symptoms, is our immune system. It's interesting to me. A lot of the bacteria, as I mentioned before, live in our body all the time. They don't cause disease all the time. And even when people are exposed, let's say that flu breaks out, as it does typically every winter, and it's in the air. It's on the door handles that you're touching all along the way, and everyone you hug. But not everyone gets ill every year. So what's the difference? What is the reason? It's not just the exposure to a pathogen, but it's it's quite possibly how our immune system is, what kind of shape it's in that day. So that's the subject that I offer. But we do also have a caller on the phone. So let me pause there and see if this person is interested in the same subject or maybe something different. Welcome to Slow Medicine Radio.
Hello, my name is Rick. How are you?
Very good, Rick. How are you?
I have a question in regards to what you're speaking about with Mrs. Clinton. She just purchased a new airplane to go around on her campaign. Now, circulated air, as you know, Doc, in an airplane is not the best. And if she has pneumonia, wouldn't other people on the plane contact with her receive the pneumonia also?
Well, that's yeah.
And why would she be out after the attack that she had, touching a child, or going to her daughter's house with a baby?
Yeah.
So I doubt. I'm not a doctor, but I doubt if that is the cause of what's going on with her. And there's another report of the dark blue glasses that she has on in the video. They're specially made in Europe, not made here. That might be something else also with the sunlight and the huge lights of the press and TV. So I'm wondering what you think of that.
I think what you're asking are very important questions for us as a society looking at a potential president to understand these things better. The health condition of these candidates is relevant. And I share some of your, not just concern, but even some of your suspicions. A lot of what I know, meaning what I'm hearing and what I see. So that's not everything, by the way. And I think we all have to be somewhat humble in terms of how much we know. But there seems to be something that's not being disclosed to us, some inconsistencies. And so I agree with that. That makes me a little nervous. But I don't know a single political candidate, quite honestly, who doesn't hide things. Because they always want to look good, because they want to look strong, and they want to be representative. And even we do, too. Don't we want to look good in front of our kids when we're not feeling so good? Hold ourselves
we had
together.
the shadow of doubt with Churchill, with FDR, all of that. And this could be another turn of history again.
Yeah. So, but I think to get to some specific points you raised, one is a contagion, like on the airplane and touching a child. So let's put the inconsistencies aside. But the fact of the matter is, if you're on an airplane, because this may be practical for a lot of people, and you say, gee, I don't want to get sick on the airplane. There's really two things that go on an airplane that make you more likely to get sick, or maybe more than two. One is the fact that the air itself is very dry, just like it is this time in the fall. The air dries out a little bit. And respiratory membranes, when they dry out, are a little bit more penetrable by an infectious disease. So that's one. The other is that the circulating air and 250 passengers or whatever it is means that you are consolidating whatever infectious diseases they may be and circulating them. So yes, you might be more exposed. And third, of course, most people know that flying, even if you just do it once in a while, is stressful. You get to the airport, 2 hours earlier, usually in some form of traffic. You're up early. You're standing on lines. You're a little stressed out. All those things affect your immune system. And that's what I was talking about, right before the break or right after the break, was that how susceptible you are in the moment may have something to do with just all these other things that are going on in your life, which is the essence of slow medicine, which is to try to work these other things that are going on in your life. And so, to improve your resiliency. I think that, her whole way of living in the last year is going to make her more vulnerable to an illness. And I think that that's important. But as I said, also, when you have pneumonia, let's say it's pneumococcal pneumonia, that bacteria is in the environment all the time. All children are already exposed to pneumococcal pneumonia. It's everywhere. So touching a child, you could say, is maybe on the surface of it looks a little, funky, but I'm not sure that child is at greater risk. Viral pneumonia, on the other hand, if that's what she has, and we don't know that because it takes specific testing, sputum analysis, blood work, to really be sure that somebody has pneumonia. You have to see the bacteria, and often that's very difficult to do. So it's a clinical diagnosis. It's conjecture. It's usually good judgment on process of a physician, but it's not black and white. So anyway, I appreciate your question. We're going to run out of time, but thank you for calling. Thank you for sharing your thoughts. I think we share that concern, and of course we share the concern of just being well, all of us, all the time, and including making a good decision right now in November. I think that's really important. I would be happy to discuss the health of our country, the health of our candidates, how to be in the clearest state of mind to make the best decisions. These are all part of slow medicine, and when you do that, you wind up having the best quality of life yourself. And we are in it together. We're a community. And so thank you very much for listening. We'll be here next week. It'll be me and you every Monday at 5 o'clock on WVOX 1460 AM. And so for this week, let's all hope that we all stay well. I wish all the people who are involved in the political process to do good things. I'm certainly praying for that. Take care.